For my lecture video for our class's final project, I'm going to be talking about the 2009 swine flu pandemic. The pandemic is also known synonymously as the H1N1 pandemic, since the H1N1 subtype of influenza virus was the cause for the disease. The pandemic began in early 2009 and reached its peak primarily during the spring months in May and June of that same year. There were 100,000 to 500,000 deaths estimated to have been caused by the H1N1 viral disease in 2009. Overall, the pandemic lasted roughly 19 months. Initial reports of the virus purported the disease to have originated in Mexico, since that's where the first case of an infection had appeared, but that hypothesis later evolved. The origin, in terms of the cause of the pandemic, was believed to have been caused by a culmination of a series of viral reassortment events, which took place between multiple species. These species were birds, pigs, and humans. Prior to this pandemic, scientists identified a virus in pigs which also contained RNA contents found in bird and human viruses, forming a triple reassortment of viral contents. The CDC website states that the 2009 pandemic was caused by this triple reassortant virus mixing with a fourth virus, whose origins are believed to be from Eurasian pig populations, to form a quadruply reassortant virus, the H1N1 virus. The symptoms expressed by an infection of the H1N1 virus are primarily respiratory. It was difficult for doctors to tell a case of the swine flu apart from more common and less severe respiratory illnesses. Symptoms like a cough, sore throat, rhinitis, headache, and muscle aches were common. Some differences between the more common respiratory illnesses that circulate seasonally and disease such as swine flu are that swine flu can lead to more deadly complications like viral and bacterial pneumonia, ARDS or acute respiratory distress syndrome, and a progression of a patient's underlying conditions. Scientists had anticipated a pandemic would likely occur in the future. However, this pandemic took many by surprise because around the globe, preparations had been made in anticipation of a pandemic caused by the avian flu. Steps made to prepare for a future pandemic proved to be vital in the response to the swine flu pandemic. Prevention tactics such as proper hand washing, use of alcohol-based hand rubs such as hand sanitizers, covering coughs and sneezes, avoiding touching the eyes, nose, and mouth, avoiding close contact with those who are sick, and remaining at home if experiencing symptoms to reduce the spread were all encouraged. Vaccines began development in the first half of 2009 and were intended to be made available as soon as possible. After clinical trials and approvals, vaccines for the virus were made available in October of 2009. The vaccine was recommended by the CDC for pregnant women, caregivers of children younger than 6 months old, healthcare workers, all young people from 6 months to 24 years old, and those aged 25 to 64 with underlying health conditions. Due to the availability of treatments and vaccines for the virus, infection rates eventually de-escalated from a pandemic level. On August 11, 2010, the swine flu pandemic was officially declared over by the World Health Organization. The H1N1 virus that caused the 2009 swine flu pandemic is now considered a regular human flu virus and circulates seasonally worldwide. Because of the measures taken by scientists during this pandemic, the pandemic of 2009 provides a successful blueprint for the mitigation of the COVID-19 pandemic of 2020, which we're currently facing.